So the decision to go into medicine, I think, a lot of it was because of my grandfather, who was a physician, and I grew up pretty close to him. I think the turning point was there was a pretty bad incident back where I'm originally from Pakistan, and there was an earthquake in 2005 where people had these makeshift camps for providing medical care, and I got a chance to work with him to help some of the people there. I like to think that was a point where I said, okay, this is definitely what I want to do. And coming to geriatrics, I think throughout residency in internal medicine, my experience with older adults was the best part of my training. I really liked working with that patient population, focusing on their memory concerns, but also working with the family as a whole. Because if a patient is experiencing memory problems, it comes with a lot of burden on the caregivers. So work with not just the patient, but also their loved ones. And that's one of the best parts of the job. So depending on patient and family preference, I may meet with the family separately and then the patient separately. And then we get together and talk about everyone's concerns together. Talking about their background, getting to know them better, what's their social life like, what's the family support like, what was their baseline like? Because when I see them, that's my first encounter with them. I like to know how were they months ago, years ago, how independent they were, because one of the goals is to try to keep my older adults in their homes for as long as possible, try to maintain their independence. And I can only do that if I have a good understanding of their background. So that's, in a nutshell, kind of our first visit, and then we go from there.